depending on reaching certain goals, you should be ready to go home. For example, you need to be able to walk safely with your walking aids. You should also be able to manage the stairs, even if you don't have them at home, and you'll need to be able to get on and off the bed, chair and the toilet by yourself.
Your occupational therapy team will have worked with you to ensure you can dress yourself using the dressing aids. Here's an example of the sort of things you'll be doing.
The grabber is going to help you get dressed. So what we're going to do is we're going to start dressing the operated leg first. What I'd like you to do is grip the side of your garment and lower it down to the floor. I'd like you to feed your foot through. Once your foot is through, pull it up to your knee. And you do the same process with your unoperated leg.
To get undressed, reverse the procedure.
Next we're going to move on to is the sock aid, okay? I'll give you those. There we are. So what I'd like to do is feed the sock on to the sock aid. All the way. That's it. Grip the sock to the bottom, yep, and give it a stretch. And the full length of the strings just to lower it down onto the floor. Then you're going to slide your foot in, all the way. Then point your toe to the sky and give a good pull up. That's it, lovely. And then with the grabber, you can use the grabber then to pull your sock up. Okay. The important thing to remember is to keep your foot nice and straight and not to turn your foot in like a pigeon toe.
Using the grabber, position your shoe in a comfortable place in front of you.
Then to get your shoes on, you can use the long-handed shoe horn to help get your foot into your shoe.
Plan for coming home before you come in. You might need to take up any loose rugs and declutter so that you've got plenty of space to move around with your walking aids. Also, have a small table next to your chair so you know you've got useful things like your glass of water and a phone all within reach. If you live alone, plan your kitchen, your meals and your shopping. And make sure you have enough food in. Also, if you do live alone, it's helpful to arrange for a relative or a friend to stay with you on discharge, just for a short while. Alternatively, you could stay with them. If you're concerned and you haven't got anybody who can stay, try and make some arrangements before you come in. Let us know as soon as you come in if it's going to be a problem.
On discharge, we'd give you some blood thinners to take for 35 days to reduce the risk of blood clots. Also, your X-ray and blood tests need to be okay and you need to be managing to use the toilet. You'll have a practice nurse appointment at 2 weeks, usually at your GP surgery for wound check and removal of clips. And usually at 6 weeks, you'll have a review appointment with your consultant. Some consultants see you sooner, but it is normally 6 weeks. If you have any concerns at all when you go home, you can always ring the ward to ask for advice. It will generally be about 6 weeks after your surgery before you can drive, and you'd be coming back to see your surgeon at about that point, so he or she can discuss that with you. Obviously, use your common sense. You need to be able to sit comfortably in the car and do an emergency stop if you have to, and we need to make sure that you're safe for other road users. You should inform your insurance company that you've had your hip replaced. They don't put your premium up, but they do need to know about changes to your medical conditions. If you're going home in a car, a regular saloon car is easiest. You'll be sitting on the front passenger seat, so ask your family or helpers to push that seat back as far as it can go and tilt it back a little to make it easier to get in. It's often easier to put a plastic bag on the seat so you can slide more easily, and so you turn around until your back is against the seat. Your bottom goes in first, both hands on the seat or one hand on the dashboard and one on the seat, and push yourself right back so that you're getting your back well back towards the handbrake. And then you bring your legs in last. Some people prefer to bring both legs in together, and some people prefer to do a little bit at a time. You can do it either way. To get out of the car, we reverse the procedure. Take your bottom slightly towards the handbrake, bring your legs round towards the door and just ease yourself forward. We'll discuss this with you when you're on the ward. Would recommend not going on long car journeys. However, if you're travelling for more than an hour, you should get out and walk about because otherwise you tend to stiffen up. It's better to get in on a flat surface, so don't step out from a curb into the car or you'll find it more awkward to do. For the first 3 months after surgery, we don't want you to bend with the new hip too far, cross your legs or twist your new hip. Your occupational therapist will explain the best height of chair for you. Don't cross your legs or your ankles for the next 3 months, and don't have your leg twisted in when you're walking or doing activities. We'd like you to sleep on your back for 6 weeks after the operation. For 3 months, we'd like you to use a raised toilet seat if you've got one. Please return your walking aids when you no longer need them. We can take back metal crutches, walking sticks and walking frames. We can't take wooden walking sticks or toilet aids, seat risers, dining trolleys or perching stools. Sometimes they take them at Age UK. Thank you for watching. There may be some differences depending on which site you're going to have your surgery, but I hope this gives you a general introduction.